Okay. Um, Today's agenda, I'm going to be talking about giving kind of an introduction so folks are grounded, and then talking about the history around gender care. So I think these are probably in the first 5 questions, but I would love it if folks could put in the chat your professional discipline, how long you have been working with transgender and non-binary young people, and the most important thing that you hope to learn from these many, many hours that you're going to spend with us. That information really helps guide us in how we deliver this material. Many of you, I think I heard Kathy reference, have been here and listened to our training in the past, and I'm hoping that some of you have not, so this material is new as well. All right, let's get started. So I am the medical director of the Center for Trans Youth Health and Development at Children's Hospital Los Angeles. I have been providing many services, including medical services for trans and non-binary children, adolescents, and young adults. And I've been doing that work for the past 18 years. So I want to talk a little bit about how visibility has changed over the 18 years that I have been doing this work. So many of you probably are old enough to remember when what was in the media were pretty significantly awful representations of the community. So GLAAD did this study. For folks who don't know, GLAAD is the organization that is responsible for thinking about representation of the LGBTQ plus community in media. And they looked at 134 episodes of television where a trans character was brought on just to be a guest. And what they found was that the most common profession for a trans character was a sex worker. And so this is kind of the visibility. And there was, and this, of course, just to be clear, I love Priscilla, Queen of the Desert, but I think there were very, very clear and very primarily negative representations of the community. For the first probably 15 years that I was doing this work, what we saw was a shift in what was being demonstrated in the media. So you have not just more positive stories, but also stories about youth. And this is really important when we think about how the care and the seeking of care has changed related to media visibility. We have also seen people's court cases. For example, Gavin Grimm, who sued his school district to be able to use the correct bathroom. And then we also have seen, gratefully, an uptick in trans individuals, actors and actresses, playing trans characters in pretty mainstream media. And all of this has been really helpful for visibility. But I do want to point something out that I think is really important. The 3 kiddos on the left that you see all have something in common besides being trans kids. They are all white. And I think that this is an issue that we face across the country and probably in Western Europe as well, that there is a disproportionate compared to population numbers of people accessing early care, including puberty blockers, that are white. And so it is important for all of us to think about what those barriers to care are for other communities and work really hard to dismantle those barriers. But over the past 3 years, we've seen a different kind of visibility, and that visibility is also really problematic. So as you all know, if you're working in this space, these are actually from a Google search I did last night because I like to stay current with this information. And you can see that all of these 6 headlines, and there's many more, are negative, and they speak to moves being made to ban access to care around this country and also internationally, particularly in Europe. This is a little bit about my own clinic and reflected by many clinics around the country. Although we have the largest youth clinic in the United States, these numbers are smaller, but a similar trend that we have seen across the US and also in Western Europe. So here in this graph, you can see this is the numbers of youth who are referred over to our clinic. And I think that numbers are really important, and they're often used against care providers, parents, and most importantly, community members. That in the largest clinic in the country, we are still not seeing thousands and thousands of people every year. And I'll talk more about numbers later, but you can see a clear shift starting in 2015, where the numbers of young people who are being referred over to our clinic go up, and there's a shift in ratio. And really critical to remember that we see adolescents and young adults and the emergence of more individuals who identify on the trans masculine spectrum, so people who are registered female at birth, and an increase in the numbers of people with non-binary gender identity labels. I think all of us probably know this, but language is really critical. It's really important. The terminology that we use is dynamic. Youth are primarily the ones creating the terminology. And so it is important for people to check in and be updated about the language that's being used. Labels may mean something different to different individuals, and I always tell people to err on the side of asking. And that also applies to utilizing specific body part language, because for some people, they may not be triggered by using anatomic names for body parts and organs, but other people might be. And so I check in with my young people and ask them what feels the most comfortable for them. I do want to give us some language so that we can kind of be grounded together as we work through this information today and then over the next 3 days of the seminar. So I created this gender abacus many, many years ago. And the primary reason that I did this is that I had a lot of parents who, like many, many people, were conflating gender identity and gender expression. And so I have a physical version of this in my office that has 10 beads and 20 spaces, but I also created a digital app so that people could help explain to me where they were situated, but also explain to their parents. And I'm going to preface this by saying, I actually don't think that female and male are the ends, like some kind of linear relationship to each other. I'm going to talk about this more when I talk about non-binary folks. But I think for the purposes of non-community members, this is the way that people think about and understand gender. I'm going to go through each of these things. So our designated sex at birth, or registered sex at birth, is really what happens when somebody is born. So I've been in a lot of births. That was part of my training. And if somebody has not gotten chromosomal information, when a baby comes out, if said baby has a penis and testes, they are labeled or registered as male. If they do not, they are registered as female. I could do a whole hour just on that. Sometimes people have information even before birth through an ultrasound or karyotyping. just want to draw people's attention to the last pair of chromosomes. In humans, we have 23 pairs of chromosomes, each, and 23 pairs, but sometimes there's more than two. I think that's important to talk about it for another time. The last set of chromosomes are the XX, XY, and Y variations of those. And those are primarily what guides the fetus into developing the physical secondary and primary sex characteristics. And again, I'm not going to spend a lot of time talking about the intersex community or differences in sex development or sex characteristics, because that would take me another several hours. There is overlap in the intersex community with the trans community, and I'll talk about that where it's relevant, but I think that's what I'm going to include about that. What about gender identity? So I think that this is a really important nuance, that a gender identity is both a label and an experience. So it's an internal basic sense of being male, female, both, neither, or something else entirely, especially as it is experienced in self-awareness and behavior. And this is one of the hardest things about this work, is that gender identity is something that each individual has and carries inside of them, and is not assumed just by looking at somebody. People label their gender identity in many, many different kinds of ways, and I'll talk about that tomorrow as well. So it is true, and I think this is important, that the majority of people, for example, who are registered male at birth, identify as male. And the majority of people who are registered female at birth identify as female. But over the next several hours, we're going to talk about situations where that is not the case. What about gender expression? I think about gender expression as the way a person communicates their gender to those around them. And it doesn't just include clothing and hair and name. There are also many, many different ways across cultures where people perform gender in a way that is stereotypical for men and women. And so there are, in addition to these kind of cues that we give about our gender to the world, there are also ways that we perform our gender that give people around us cues. And this is kind of baked into the way that we learn about gender from the time we're really small. And I'm going to talk about that in a minute. So synthetic hormones were and early 1930s. But before that, trans people have existed since people. But before that, really the way that people kind of did their gender or, were able to live in a gender that felt authentic to them was through clothing and their occupation. So I love this quote from Emmanuel Herman: "Clothing is the unconscious language of the spirit, and clearly expresses itself all the more when the tongue is condemned to silence." Why is that important? Because people were not able to freely talk about their experience of their gender. So in order to feel more comfortable, people would adopt clothing that felt most appropriate for them. There's an amazing book that I recommend. Somebody's not muted. Is this a comment to me or there's an amazing book called Not Straight out of Germany. And that book really talks about kind of the origin of the gay rights movement, and talks about trans folks and trans experience, the way that trans folks were talked about in 1910 was very different than the way that we talk about trans experience now. But there are all these great photos about people trying to live authentically. Highly recommend. So it is also true that for people registered male at birth, they identify as male and they want to express their gender expression in the way that the society thinks you should. You get a lot of messages about this from a very early time. So, for example, if you do a Google search for boys' toys, this is what you see, you know, construction equipment, tanks. If you do a search for girls' toys, you get stoves and babies, right? So there's a lot of very clear and kind of consistent messaging about how to do your gender in a way that is going to be okay and acceptable to the society. Here's another thing about clothing, right? The girls just love me. So it's only going to be heterosexuality, but it's also sort of giving this kind of idea about what it means to be a boy. Mama ain't raising no fool, right? And then here's, this is what you get when you look for girls' clothes, right? And I props to this, at least there's reasonable shoe wear. So we have assumptions in our society that cause us to gender people based on these social cues. I want to give you some examples. Here is a bag. It is presumably for carrying personal articles. And here is a bag, presumably for carrying personal articles. Here is a coat, presumably to keep you warm. Here's a coat, presumably to keep you warm. Even if you covered up these people's heads, you can see also not a comfortable shoe wear on the left side. If you covered up these people's heads and their hair, you probably would gender the person on the left female and the person on the right male. In my work, I do a lot of work that's not related to medical intervention, but I do also a lot of work that is related to changing somebody's physicality or phenotype so that they can feel more comfortable. But I think there are things that you wouldn't necessarily think about if you weren't doing this work, that are physiologic differences in skeletons and in features that are XY chromosomes or registered male or XX chromosomes or variations of these. So in people with XY chromosomes, they generally tend to have a more forward-facing brow, which means that their eyes are set back further. And you can see also that not all, but a lot of people with XY chromosomes have Adam's apples. Not everyone. And there are some XX individuals who have Adam's apples, but predominantly this is something that you see in men or people who've taken testosterone. There's also a longer length between the bottom of the lip and the bottom of the chin. So if you compare the left and the right side, obviously these are just two examples, but in general, this tends to be true. And then my last domain on the abacus is sexual and romantic attraction. And I put this in again because there's a lot of conflation with sexual and romantic attraction and gender identity. So the majority, while there are a lot more LGB folks than there are trans folks so far, there is still a majority of people who identify as heterosexual. So if they're registered male at birth, they have a male gender identity, they want to express that in a masculine way, and then generally have sexual and romantic attraction to women. Or they're registered female at birth, they identify as women or girls, they want to express their gender in a more feminine way, and they are attracted to boys and men. Okay. That's not what we're talking about for the next 14 hours. It's probably 13 now. We are talking about people who are registered one sex at birth because primarily their genital anatomy or their chromosomes, and they identify as something other than what would be expected in the majority of people. So they're registered female at birth, they identify as male or somewhere along the masculine spectrum. Or people who are registered male at birth, but they identify somewhere along the female spectrum or trans feminine spectrum. And of course, every variation, including those that line up in the middle or half and half or anything else, but they are not cisgender. And I'll talk about that right now. So for a very long time, the way that we talked about trans experience was really problematic, and it created a hierarchy that made cisgender experience preferential. So this word, cisgender, actually comes from chemistry. So a molecule that has two atoms on the same side or are adjacent to each other is called a cis molecule. So in people, we're talking about people registered female who identify as girls or women, or people who are registered male and identify as boys or men. Okay, a trans molecule is a molecule that has atoms on across or opposite sides. And so in the case of people, we're talking about someone registered male at birth who identifies as a girl or woman or somewhere on the trans feminine spectrum, or non-binary, or somebody registered female at birth who identifies as male or along the trans masculine spectrum, or non-binary. I know that there is a lot of, even within the community, feelings about the way that we talk about the community. I, for the most part, talk about trans experience to mean non-cisgender. I umbrella everybody under the trans umbrella, and I know that doesn't sit right for everybody. And I just want you all to know that I am not excluding non-binary or agender people in that umbrella. All right, so what is gender? Is gender our chromosomes? Is it our reproductive tract or our genitals? What about our role of rearing or a socially constructed definition? Is it a legal designation? Is it all of these things? So I think that for folks who pay attention to some of the legal stuff that is happening right now, kind of hear all of these things. And really, I think, or have come to believe after the years of work that I've done, is that mostly gender is like an onion. It has all of these layers, and it's whether you're a trans person or a cis person. And, you know, sometimes gender makes us cry, and sometimes we cut it up and put it in spaghetti sauce and it's delicious. So gender is really multi-layered, and we're going to talk about it, think about it as such. Important to remember that we start this process of gendering or assuming somebody's gender very early, right? So sometimes we get an ultrasound when somebody is in utero, or we get a karyotype for whatever reason. And it is really still common that people start to create stories, future stories about their unborn child. In 2007, this practice of gender reveal parties began. And so these were parties to celebrate even a child who was not yet born. That's sort of a story about their gender. So guns or glitter, what's in the oven, a sweet little cupcake or a handsome stud muffin. I think like all of these things tell us about how people are thinking about and creating stories related to the gender of their unborn child. And these gender reveal parties are often very gendered. So they preclude us from thinking about, even in cisgender kids, that these qualities of people can go beyond. I mean, they can be things, not necessarily guns, but they can be things that we would like all young people and then adolescents and adults to think about as part of their personality. So what happens after that? What happens after that is, if you have a person without a penis, you put him in a room like this, or if you have a person with a penis, you put him in a room like this. These cues that are in people's rooms, and I see this less and less now than I did when I started this work, but these cues give babies and children messages about how to perform their gender. This is a ubiquitous situation. I did a search relatively recently. If you look for back to school supplies, you can see on the left, back to school supplies for girls, although I do appreciate the trans colored backpack. But in this set of things, you can see, makeup and, nail stuff and earrings and chapstick or erasers or whatever those things are. And on the right side, you see a backpack and food. I think this is really important. So on the back to school supplies for girls, there's no food. And I think that is its own message. Most people don't really think about this unless you do this work or you're part of the community, right? It's really overwhelmingly pervasive. I can tell you that I've looked in a lot of people's ears, and you don't need, skull screws if you have testes or XY chromosomes, and you certainly don't need pink earplugs if you identify as female. Here's Bounce fabric softener for men and those who smell them. And then it also is true that, girls don't need a specific kind of tape. Our fine motor skills are intact. And so but it's important that people recognize how much this happens. And this is going back to this issue around food and the sort of policing and expectations around the bodies of women, the bro nut, snack like a man. If you think this is only for children and adults, look at this. This is, a thing for a 3 to 18-month-old, for a sweet baby girl, and it's a ring rattle. And this one is for a busy baby boy. It's a saw, and it has a mirror in it. So when we think about how and why people come to understand their gender, to understand the gender cues that they are getting from a very early age. There's also, this product, minoxidil, which is for hair loss, is not different. It's the same concentration. It smells the same, by the way, terrible. But the only difference is that the price on the women's one is higher. And so there are all kinds of things happening. This is all wrapped up with putting people into an environment that we feel like represents their gender, and we wrap it all up with constant reminders about gender expectations from media. So all of this assumes that your gender is aligned with your primary or secondary sex characteristics, and by default, your chromosomes. And that particular way of thinking is called gender essentialism. Gender equals genitals. Well, what's wrong with that? Well, it erases trans experience and trans people. It creates kind of a chronic environment that's skeptical and now increasingly hostile, that creates a scenario whereby individuals have to prove their gender before they can be affirmed, either socially, legally, and certainly medically. It establishes and continues to support a hierarchy that privileges cisgender people. and it results in barriers to accessing necessary care. Gendering in this way is traumatic for all of us. All humans, whether you're trans or cisgender, right? And so you can see that these experiences that are happening right now across the country where youth care is being banned is adding to the traumatic load that mom said, well, my kid likes to wear dresses and play with dolls. And this 4-year-old kind of leapt up and put their hand over their mom's mouth and said, don't tell the doctor. And in that moment, what I realized is that this young person had already started carrying their gender, about not even their gender necessarily. It doesn't even matter if this kid is a girl or a boy or non-binary or something else entirely. What this kid had, what was clear and obvious, was gotten messages about the things they like to wear and the things they like to play with were not okay. And that message creates shame for people. And that was really an important thing that I recognize for even in a child who's 4 years old. Was a social construct, and that, you could raise anybody in any gender, and that's where they would kind of stay. So they did work on gender development, and what they found was that by the age of 2, children become conscious of the physical differences between boys and girls, and primarily this means genital anatomy. Before their 3rd birthday or around their 3rd birthday, most children are easily able to label themselves according to what they've learned about gender as a boy or a girl. And by age 4, most children have a stable sense of their gender identity, knowing that, for example, if they put on different clothes or, carry a handbag or whatever kids are doing, that their gender identity is the same. It doesn't change. From birth, as I showed you some examples before, children quickly learn that a lot of their lives has to deal with the concepts of masculinity and femininity, right? These hangers on the right are labeled as boys hangers, I guess because they're blue. And then there's girls batteries below that. And so these are clearly things that young people are going to be exposed to at even a very young age. If young people have children that have parents that are very interested in guiding them into doing things that are stereotypically thought to be assumed with gender, they will give covert and overt messages of disapproval for not complying with those norms. And so it is these kinds of messages that solidify the understanding of children about gender roles. And I am going to tell you why all of this matters in a minute. Children obviously internalize parental messages because a lot of times their parents are the most important person to them in their life. And they will look to adult people that share a gender that they are assumed to have for role differences. What about peers? So, whether or not a child is cisgender or trans, they're going to like certain things. But as they explore those things, whether or not their peers approve of those choices is going to be crucial in whether or not they will continue to demonstrate an interest in those things. Not if they will continue to have an interest in those things, but whether they will continue to do them. And this is important because the interests that a person has are innate. You're just interested in something, or something makes you happy. It's not, but the behavior related to that is mutable based on the messages you're getting from people around you. I had a kid once who came in, and this kid, who is registered male at birth, said, I asked this kid, what's your favorite color? And this kid said orange. And the mom said, no, it's not, it's pink. but a bunch of and this kid, I think, was about 6, right? So first time in kindergarten, where there's peers around who had said, your favorite color can't be pink because you're a boy. And so this kid had sort of shifted and said, my favorite color is orange. Gender identity for trans and gender diverse children is happening in a cis-normative environment. And this is why I'm showing all of this stuff, because I think it's really important to understand that figuring out that your gender is not what it's assumed to be is a puzzle, and it's different for each young person, and it's impacted by multiple aspects of someone's life. And I know that Darlene is going to talk about this later, but I think of this as young people trying to swim upstream in a downstream world. So if you are a cisgender person, everything is created in your world and your environment that supports your cisgender situation, right? So you're just swimming along. You don't really have to ask this question or think about it. But for trans and non-binary young people, they are swimming upstream and trying to figure out what's going on with their gender. And because of that, people are going to understand their gender at different times, right? Some people are going to talk about their gender when they're 5 or 3, and some people are going to do it at 13, and some people are going to do it at 30, and some people are going to do it at 50 or 70. And so when you're hearing information about, well, this kid did none of this when, my teenager did none of this when they were young, think about this slide and about what that young person needed to do to put their gender puzzle together in order to get somebody's attention around it. So I want to talk about this kid. I asked this kid's mom to write a little kind of summary of her experience of her child at 3 years old. This kid's story was profiled about 12 years ago on public TV, so it's not it's out and available. But this is what this mom said. At age 3, Jay started acting out, and this mom is gendering this kid according to registered sex at birth. He would have tantrums when I would drag him into the barbershop for his bi-monthly haircut. They were on a military base. Shopping for clothes, he would excitedly head toward the girls' department, only to end up in tears as I redirected him to the boys. Putting his uniform on each morning for school, he would untuck his shirt and modify it to the best of his ability to match the girls' uniforms. During the night, he would wake up and tear the paper from his walls, pull down his drapes from the windows, strip the bed of its sheets, and basically destroy his room. My baby was cracking, and I had no idea where the pressure was coming from. So the story of this kid is that this went on for a couple years, and at this kid's 5-year well visit, the mom was explaining these things to the doctor, the pediatrician, about her child, and the doctor said, is it possible that your child has what was then labeled gender identity disorder, but is now called gender dysphoria? And the mom was like, what are you talking about? And she took this kid home and said, do you want to live as a girl? And this kid said, yes, I am a girl. And so this young person underwent a social transition. And I'll share a picture of her in a minute. What happens when a kid does not fit into their anticipated box? Some of you may have seen this video before, but I think it's incredible. And I give such great props to this mom who put this story into a very understandable experience of what she went through as her child tried to tell her about her experience.
Six years ago,
Can you hear
I
it?
gave birth to my first and only child. A boy.
I'm 38. I'm 29, and I really love you.
When he was 2 years old, my son began insisting on wearing only pink clothes, preferably ones with lots of sparkles and ruffles on them.
She dresses so pretty. She really loves me.
When he turned 3, he begged me to buy him some dresses and let him grow his hair long. That made the grandparents a little nervous, but we went with it.
That one's a fairy and that one's a princess.
Why is she a fairy and she's a princess?
Because fairies are magic and princesses don't. That's the difference. And also, they can't fly and they can't. Fairies fly and princesses walk.
And then one day, in a conversation that I kind of knew was coming, but it still knocked the wind out of me, my child told me that he was actually a girl, not a boy. He looked me in the eyes and told me something had gone wrong in my tummy that made him come out as a boy instead of a girl. He wanted me to put him back. He begged me to put him back, to fix this mistake. He was 3 years old. I spent the following year resisting, trying to present alternatives. I told my child over and over again that he could continue to be a boy and play with all the Barbies he wanted and wear whatever he liked, dresses, skirts, all the sparkles money could buy. But my child said no, absolutely not. She was a girl. What are your favorite things to play with?
My princess things.
Your princess things? Why do you like princesses so much?
I just kind of do.
Do you think it's okay for boys to like princesses?
But I'm a girl.
After 12 long months of making both myself and my child miserable, I finally let my little boy go.
Goodbye. Now let's do it. Twinkle, twinkle, little star.
We switched to female pronouns and told our family and friends that she was a girl now. She wanted a new name, a girl name. At first, she picked Rainbow. I was relieved when she changed her mind and named herself after her aunt. So now I have a girl,
Talk about princesses.
a daughter.
Actually, I need to hear about how spaceships fly.
A really happy daughter. I adore my daughter. But sometimes I look at photos of my baby boy and I miss him so much. This probably sounds crazy, but sometimes I wonder where he is. It's like he was a dream I had one night. And then morning came and I woke up and he was gone. And now there's this little girl in his place telling me that the boy was just a dream, just someone I imagined. As far as she is concerned, there never was a boy. Could you explain that to me one more time? What's the difference between you and Holly?
She's a vagina and a penis.
Yeah.
A girl with a penis and she's a girl with a vagina.
You're a girl with a penis and she's a girl with a vagina?
Yes.
So now that I have a daughter instead of a son, what does this actually mean for her? And for me as her mother? Other than letting her wear pretty dresses and using different pronouns, what has actually changed? What does this newly minted girl need to know? What do I need to teach her about how to be a girl?
Girl alien does all the work while the boy alien sleeps and eats.
Do I even know how to be a girl?
The girls also have blue and purple spots.
And if a girl can be a senator or an astronaut or a plumber, if a girl can wear pants and have short hair, if a girl can even have a penis, what is a girl anyway? Who gets to decide if you're a boy or girl?
Me.
Okay, so I really appreciate Marlo Mack for putting her own experience into this type of little cartoon so that people can kind of see what she went through as a parent. If you want to see more, she has many of these that talk about her child growing up, and there's some with her child in them, and now her kid is a teenager. But I do think, you know, there's one with her daughter giving advice to other trans kids in the country. It's really quite amazing. So I really do want to be clear that not everybody who has this experience in childhood is going to continue to identify as a different gender in adolescence and adulthood. I do think that is important. There are lots of people who are designated male or registered male at birth who like to wear dresses and play with dolls. But I think that this child's assertion about her gender is a really important factor in her continuing to assert a female gender identity. There are diagnostic criteria for gender dysphoria in childhood. I don't spend a lot of time on this because you can all read them and go through and check these things off for people. I know that Aiden is going to spend a lot of time talking about gender dysphoria outside of the diagnostic criteria. And in some ways, whether people meet these diagnostic criteria in childhood is not super relevant for me as a medical provider, because there are no medical interventions for people who are not yet in puberty. But there is this definition, and there's some issues with it. So this incongruence between one's experienced or expressed gender and their assigned gender of at least 6 months duration. And then as manifested by 6 of the following things. So a strong desire to be of the other gender, or an insistence that he or she is the other gender, or some alternative gender. In people who are assigned male at birth, a strong preference for cross-dressing or simulating female attire, or in assigned girls, a preference for wearing only typical masculine clothing and a strong resistance to the wearing of typical feminine clothing. I really cannot stress this enough, that the trajectories of development for trans masculine and trans feminine people are vastly different. And it has to do with the patriarchy, it has to do with misogyny, and our feelings as a society about people that we perceive to be men in women's clothing. Okay, so look at the language in here. If you are designated male at birth and you want to wear stereotypical girls' clothing, here we call it cross-dressing. However, if you are designated female at birth, you have a strong preference for wearing typically masculine clothing, right? And what does that even mean? Does that mean pants? Does that mean a sweatshirt, right? So you can just see that we still have, when we think about clothing, a much more stringent criteria for what we describe as male versus female clothing. And even in these diagnostic criteria where we codify this feeling, more negative feeling about people who are registered male at birth. A strong preference for cross-gender roles in make-believe play or fantasy play. A lot of times my kids will tell me about the avatars that they use and that their avatars maybe they are exploring some of their gender or questions about their gender through their avatars. I think that's an important question. Back in the day when these criteria were first conceptualized, this was about like playing house and stuff like that. Then there are these things, a strong preference for the toys, games, or activities stereotypically used or engaged in by the other gender. A strong preference for playmates of the other gender. For registered boys, a strong rejection of typically masculine toys, games, and activities, and a strong avoidance of rough and tumble play. I mean, a lot of this stuff is kind of a vestigial tale from the way that we talked about gender back in the 1950s. And this criteria 7, a strong dislike of one's sexual anatomy. And, reminding people that your sexual anatomy is not just your genitals, right? Your brain is actually the biggest sexual organ in your body. There are many, many issues and concerns with these criteria. But I want you to know them because sometimes we need to make these diagnoses in order for people to get services. And then a strong desire for the primary and/or secondary sex characteristics that match one's experienced gender. And when this diagnosis moved from gender identity disorder to gender dysphoria, I think that there's an important movement that happened here that there's an effort to depathologize the experience of being trans from the distress that having a body that doesn't necessarily reflect your gender. And those are two different things. So this B criteria was added on. Again, for prepubertal children, these diagnostic criteria are not super useful. In these younger kids, what we often see or what parents will report as the first major conflict is really around underwear. Parents have a lot of latitude for letting their children wear whatever they want, and this is especially true now. At least in California, but this sometimes causes problems in the family where kids will want different kinds of underwear. Props to these kids that make assertions about how they should use the bathroom. I like this one. This is like a registered girl at birth who's like, no, I'm going to stand up to go to the bathroom, which is usually messy. This is something I commonly see. Somebody maybe starts out with longer hair and says, no, I want a haircut. And they get a haircut like this. And then they say, no, not really. I actually want a haircut like this. And so I call this so affectionately the ascending bob in little kids. For trans feminine kids, I see a lot of like moving into hyper feminine or hyper masculine spaces, right? These hyper masculine expressions of how they want their clothing to look based on what they have learned as little babies up to childhood.